A very good evening to all of you. Today we are going to do the important MCQs of dermatology. Dermatology is a good weightage subject, though it is a small subject. But if you master this, you are sure to get at least 10 questions correct because dermatology is such an important clinical subject. So let's move to the first question. Fox-Fawley disease effects. Now, what do you think is the correct answer here? A. Sebaceous gland. B. Acrine gland. C. Apocrine gland. D. Any gland. Fox-Fawley disease or apocrine malaria is a rare, chronic, inflammatory skin disease affecting the apocrine gland. It presents with a pruritic papular eruption, primarily in areas rich in apocrine glands such as axilla, areola, and anogenital region. So the correct answer here is C. Apocrine gland. Now moving to the next question. Moving to the next question. Which of the following is the most common form of malignant melanoma? A. Nodular. B. Superficial spreading. Nodular. B. Superficial spreading. C. Acral lentiginous. Acral lentiginous. Fox-Fawley disease or apocrine malaria is a rare chronic inflammatory skin disease affecting the apocrine gland. Presents with a pruritic papular eruption, primarily in areas rich in apocrine gland, such as the axilla, areola, and anogenital region. So the correct answer here is C. Apocrine. Which of the following is the most common form of malignant melanoma? A. Nodular. B. Superficial spreading. C. Acral lentiginous. D. Mucosal. Well, it is superficial spreading. The commonest type of melanoma is superficial spreading melanoma. The melanoma progresses through three phases: in situ radial growth, vertical growth. A primary melanoma with no recognizable adjacent in situ or radial growth is called nodular melanoma. Melanoma with similar prevalence in all ethnic groups is the acral lentiginous. So the correct answer here is B. Superficial spreading. Let's move on to the next question. Lines of Blaschko. Lines of Blaschko represent A. Lines along the lymphatics. B. Lines along the blood vessels. C. C. Lines along the nerves. And D. Lines of development. What do you think is the correct answer here? Please comment in the chat box. What do you think is the correct answer? It is lines of development. Now, what are lines of Blaschko? Lines of Blaschko are defined by a pattern determined by nevoid representing non-random lines on human skin or mucosa. Blaschko lines are or the lines of Blaschko are thought to represent pathways of epidermal cell migration and proliferation during the development of fetus. The lines of Blaschko represent non-random developmental lines of skin, fundamentally differing from the system of dermatomes. They follow a V shape over the back and S-shaped whorls over the chest, stomach, and sides, and vari shapes on the head. The lines are believed to trace the migration of embryonic epidermal cells. The stripes are a type of genetic mosaicism These lines characteristically do not follow the underlying nervous, vascular, muscular, or lymphatic structure in the skin. Lines of Blaschko are not ordinarily visible but are recognized in several cutaneous disorders that follow these parallel streaks. So the correct answer here is lines of development. Pemphigus vulgaris is characterized by all A. Positive Nikolsky sign. B. Oral lesions. C. Subepidermal bulla. Jank smear showing acantholytic cells, except C. Pemphigus vulgaris. There are intraepidermal bulla, not subepidermal bulla. So the correct answer here is C. All are features of atopic dermatitis. All are features of atopic All are features of atopic dermatitis. All are features of atopic dermatitis. A. Denny Morgan fold. B. Hartog sign. C. Darrier sign. D. Hyperlinearity of paths. So, what do you think is the correct answer here? It is Darrier sign. See, Darrier sign is seen in urticaria pigmentosa, not in atopic dermatitis. Whereas Denny Morgan fold, Hartog sign, hyperlinearity of palms all are seen in the atopic dermatitis. Darius sign is a change observed after stoking the lesions of the skin of a person with systemic mastocytosis or urticaria pigmentosa. In general, the swollen king skin becomes swollen, itchy, and red. This is a result of compression of mast cells which are hyperactive in these diseases. These mast cells release inflammatory granules which contain histamine. It is the histamine which is responsible for the response seen after rubbing the lesional skin. So it is Darius. Koebner phenomenon is seen in A. Psoriasis, B. Lichen planus, C. Warts, D. All the above. Koebner phenomenon, also called Koebner response or isomorphic response, is attributed to Heinrich Koebner, is the appearance of skin lesions on the line of trauma. The Koebner phenomenon may result from either a linear exposure or irritation. Conditions demonstrating linear lesions after linear exposure to causative agent include molluscum contagiosum, warts, and toxicodendron dermatitis. So the correct answer here is D, all of them. Heliotrope sign is seen in heliotrope sign is seen in A. Dermatomyositis, B. Scleroderma, C. Photodermatitis, D. Vitiligo. This heliotrope sign is seen in dermatomyositis. Now let us look at the different signs in dermatomyositis. Number one, Gottron's papule. Gottron's papule are violaceous papule on knuckle, dorso of hand. Now what is Gottron's sign? Violaceous erythema with edema over shoulder, arms, forearm. What is heliotrope sign? Heliotrope sign is a violaceous erythema with edema over shoulder, arms, forearm. Now, poikiloderma. There is atrophy of the skin, hypopigmentation, and dilated blood vessels over the trunk. Mechanic hand, symmetric hyperkeratosis along the ulnar aspect of thumb and the radial aspect of fingers. Shawl sign, violaceous erythema extending from the dorsolateral aspect of hand, forearm, arms to shoulder and the neck. Then calcinosis cutis. Calcinosis cutis is calcium deposits in skin in juvenile variant. The other signs of this condition, dermatomyositis, is photosensitivity, vasculitis, panniculitis, and nail fold telangiectasia. When there is extracutaneous involvement, there is proximal myositis, cardiomyopathy, Raynaud's phenomenon, and arthralgia. Now let's move on to the next question. Erythemasma is caused by A. Corynebacterium, B. Staphylococcus, C. Streptococcus, D. Herpes. This erythema is caused by it is a skin disease that causes brown, scaly skin patches. It is caused by gram-positive bacterium, Corynebacterium minutissimum. It is prevalent among diabetes and the obese and in warm climate. It is worsened by wearing occlusive clothing. It is worsened by wearing occlusive clothing. Now, erythema is caused by Corynebacterium. Christmas tree appearance in skin is seen in A. Pityriasis rosea, Pityriasis rubra pilaris, psoriasis, and vitiligo. This Christmas tree appearance is seen in Pityriasis rosea. Pityriasis rosea is a common scaly disorder occurring usually in children and young adults. It is characterized by round, oval, pink-brown patches with superficial centrifugal scale distributed over trunk in a Christmas tree pattern. The disease is thought to be a viral disease and is self-limiting and subsides in 6 to 12 weeks. The exact etiology is not known, but it is considered to be a viral disease. Human herpes virus 6 and human herpes virus 7 may play a role. Now, the clinical manifestation of pityriasis rosea is the disease starts with an upper respiratory prodrome or a mild flu. After 1 to 2 weeks, annular erythematous plaque will be seen. So the correct answer here is pityriasis rosea. Christmas tree appearance is seen in pityriasis rosea. Let's move on to the next question. Palm follics affects A. Palm and sole, B. Groin, C. Scalp, D. Trunk. This palm polyps is seen in palms and sole. An attack of palm polyps is characterized by sudden onset of crops of clear vesicles which appear sago-like sagudana. Itching may be severe, preceding the eruption of vesicles. The attack subsides spontaneously in 2 to 3 weeks. In mild cases, only the sides of finger may be affected, but in a typical case, the vesicles develop symmetrically on the palms and or soles. So correct answer here is A, palms and soles. Please click the link in the description box to join the 2-day ultimate Neet PG breakthrough blueprint event that will be occurring on Thursday and Friday, and it will benefit you like anything. It will take you to the next level of preparation. See, Neet PG, what you have to study, what not to study, and the revision is the key. The more you revise, and the more you revise and practice the MCQs, the more are the chances of getting into a seat of your choice in a college of your choice. So please click the link in the description box. The first 10 people who click the link in the description box will get this masterclass absolutely free and stay in the WhatsApp group till you get selected in a branch of your choice. Please comment in the chat box which branch is your goal, and let's see. HPV causes A. Condyloma lata, B. Condyloma acuminata, C. bubo, and D. chancre. This HPV, human papilloma virus, causes Condyloma acuminata. So the correct answer here is B. Condyloma acuminata. So HPV causes B. Condyloma acuminata. So it is Condyloma acuminata. Nail pitting Nail pitting is seen with A. Paronychia, B. Ectodermal dysplasia, C. Alopecia areata, D. All the above. This nail pitting is caused by paronychia, ectodermal dysplasia, alopecia areata, all of the above. So correct answer here is B. All the above. If you have any doubts during your preparation, you can directly WhatsApp me on this number. I will respond to the immediately within 4 to 5 hours and sometimes even immediately. Vitiligo is associated with the following: A. Addison's disease, B. Men's syndrome, C. Pernicious anemia, D. Crohn's disease. Except, well, this vitiligo is associated with the following autoimmune diseases. Number 1, alopecia areata. Number 2, diabetes mellitus. Number 3, hyperthyroidism. Number 4, hypothyroidism. And number 6, Addison's disease, multiple endocrinopathy syndrome. So the correct answer here is not seen in Crohn's disease. So the correct option here is D, Crohn's disease. Husche cell in epidermis are responsible for A. Touch, B. Temperature, C. Pressure, D. Proprioception. Well, it is touch. Yeah. Please comment in the chat box what is the correct option here. Because if you actually participate in this, you will be able to remember. And in the real exam, the MCQ solving will be like a game for you. It will be so easy for you that you will be marking all the maximum number of questions correct. And that is the key to success in the PG entrance exam. Apple jelly nodule. Well, we all know it is apple jelly nodule means lupus vulgaris. Even though that is the case, let us look at all the four options. A. Lupus vulgaris. B. Cutaneous anaphylaxis. C. Erythroderma. D. Erysipelas. Well, it is lupus vulgaris. Now, what lupus vulgaris exactly is? Lupus vulgaris is a chronic and progressive form of cutaneous skin tuberculosis that occurs in tuberculin sensitive patient. It is the most common type of cutaneous tuberculosis and has a most variable presentation. It is seen in children and young adults, though no age is exempt from this. It occurs on exposed areas like nose, eyelid, pinna, and sometimes on the buttock and the trunk. The lesions of these are solitary. They are characterized by reddish brown erythematous, annular in shape. They are annular in shape, indurated. Indurated, this word is important. Slowly increase in size, gradually progressive, healing with tissue paper like scarring at the center, peripheral crusting, blanching with glass light will reveal gray green foci. There will be apple jelly nodules. Matchstick test is positive. So this is the apple jelly nodule, the favorite question of the examiner in the NEET PG and INSC. So let's move to the next question. True about lesions of lichen planus. Again, lichen planus is the most important topic. Must know everything about lichen planus. A. Polygonal violaceous papule. B. Affects skin and mucous membrane. Are pruritic. D. All the above. Well, it is all of the above. It has all the things. Correct answer here is B. Color of tuberous sclerosis lesions on wood lamp examination is A. Bright green. B. Milky white. C. Golden yellow. D. Blue white. Well, it is blue white. So correct option here is D. Now these wood lamp questions are repeatedly asked. What is wood lamp? Wood lamp is a source of ultraviolet light. The frequency is 320 to 400 nanometer. from which virtually all visible rays have been excluded by wood, that is, nickel oxide filter. It primarily emits 360 nanometer UV light when absorbed by certain substances, fluoresces in dark, and color produced is useful in diagnosis of certain conditions. So the correct answer here is blue white. Now coming to alopecia areata, A. Autoimmune disorder, B. Allergic disorder, C. Anaphylactic disorder, D. Bacterial infection. So the correct answer here is A. Autoimmune disorder. This alopecia areata is a very important condition. It has been repeatedly asked in the NEET PG exam. Now, Whitefields ointment, they can sometimes ask about the concentration that is present. A 3% salicylic acid, B plus 6% benzoic acid. See, all confusion will be there. If you know the concept correctly, then you can mark it right. Otherwise, you will get confused. So you must know everything about this Whitefield ointment. It is salicylic and benzoic acid in a suitable base such as Vaseline or lanolin. The original ointment contains 3% salicylic acid and 6% benzoic acid. The original, but other ratios are also used. It is used for treatment of fungal infection such as athlete's ulcers, athlete's foot. Its effectiveness is unclear, but the correct concentration is yes, 3% salicylic acid plus 1% benzoic acid. Urinary retention earliest in pregnancy is A 10 weeks, B 18 weeks, 22 weeks, 34 weeks. We all know it is 10 weeks. Spaghetti and meatball appearance is seen in A. Pityriasis rosea, Tinea capitis, Tinea corpus, Tinea versicolor. It is Tinea versicolor. Malaria arises from the obstruction of A. Eccrine sweat gland, apocrine sweat gland, sebaceous gland, atopic. It is eccrine sweat gland. Please click the link in the description box to join the 2-day Ultimate NEET PG Breakthrough Blueprint event. It will be really a breakthrough in your preparation, and your preparation will move to the next level. Most of the times, we revise only the topics which we know and we leave the topics which we don't know. We have to work on the topics which we don't know so that we are able to answer those questions, all those questions. The more number of questions you answer in the NEET PG exam, the more are your chances of getting a good rank and a good seat. So practice every day. Black Petra is caused by Pitria horti, Trichosporon asahi, Trichosporon ovoides. It is Pitria horti. Onychomycosis is most commonly caused by Trichophyton rubron, Trichophyton mentagrophyte, Epidermophyton glaucosum candida. It is Trichophyton rubrum. RAS test is used in diagnosis of allergic dermatitis, seborrheic dermatitis, mycosis fungoides. It is allergic dermatitis.